Let's take a look at the anatomy of the hip joint. The pelvic girdle is the crossroads of the human body. Maintaining adequate triplanar mobility and stability of the hip joints are crucial for reciprocal motions like walking and stair climbing, as well as essential activities of daily life such as squatting and bending over. As clinicians, we need to fully understand hip and lower extremity anatomy if we are to appreciate how it affects our patient's pain and functional limitations. Let's start by reviewing osseous anatomy of the hip. The hip joint, or femoroacetabular joint, is a ball and socket joint. I'll refer to this as the FA joint for the remainder of this presentation. It is comprised of the most proximal end of the femur, known as the femoral head, which forms the ball, as well as the inferolateral portion of one hemisphere of the pelvic girdle, known as the acetabulum, which forms the socket portion of the joint. The ball forms a convex surface that can move freely in 360 degrees in the concave socket of the acetabulum. This multiaxial motion results in the FA joint being one of the most mobile joints in the body. The tibiofemoral joint is the articulation between the distal end of the femur and the proximal end of the tibia. The tibiofemoral joint has both medial and lateral weight-bearing components, where convex femoral condyles articulate with flatter tibial condyles. The femur is the longest bone in the body and is the only bone located in the thigh of the upper leg. The proximal end of the femur consists of the femoral head, neck, greater trochanter, and lesser trochanter. The head is directed upward by the femoral neck, a short cylindrical portion of the femur that connects the head to the femur at an angle for articulation with the acetabulum of the pelvis. The greater trochanter, a large eminence at the junction of the neck and body, provides leverage for the gluteal muscles. The lesser trochanter is a smaller, conical eminence that provides a common attachment site for the distal tendon of the iliacus and psoas major, the primary hip flexors. The FA joint is secured by a strong joint capsule comprised of three capsulo-ligamentous structures. The Y-shaped iliofemoral ligament reinforces the FA joint anteriorly. It originates from the anterior inferior iliac spine and proximal acetabular rim and attaches distally to the intertrochanteric line. It prevents hyperextension of the femur and is the strongest ligament in the body. The pubofemoral ligament supports the joint capsule inferiorly and anteriorly and combines with the iliofemoral ligament medially. It originates at the superior ramus of the pubis and attaches to the intertrochanteric line of the femur. It limits excessive abduction of the FA joint. Lastly, the ischiofemoral ligament supports the posterior FA joint capsule. It originates from the ischium of the pelvis and attaches to the intertrochanteric line of the femur. It stabilizes the femoral head medially in the joint and also prevents hyperextension of the femur. The FA joint is a synovial joint. That means it's a joint with opposing bony surfaces that are covered in articular cartilage and surrounded by a joint capsule containing synovial fluid. Articular cartilage is hyaline cartilage, a white, semi-opaque connective tissue that decreases friction by providing a slightly compressible, lubricated, and wear-proof surface. In the FA joint, articular cartilage covers the proximal head of the femur and the concave surface of the acetabulum. Surrounding the rim of the acetabulum is the acetabular labrum, which is a fibrocartilaginous tissue that deepens the acetabular cavity and increases its articular surface to improve joint stability. It also protects the edge of the bone. It forms a complete circle to surround the head of the femur for added shock absorption and to prevent dislocation. Now let's review the hip musculature. The hip has a variety of muscles that allow for three-dimensional hip movement in the sagittal, frontal, and transverse planes. Hip flexion is primarily performed by the iliacus and psoas muscles. They share a common attachment site on the lesser trochanter. Hip extension is primarily performed by the gluteus maximus and hamstrings. Hip medial rotation is primarily performed by the gluteus medius, gluteus minimus, and TFL. Hip lateral rotation is performed by a group of muscles. These include the gluteus maximus, piriformis, externus and internus obturators, superior and inferior gemelli, and quadratus femoris. Hip abduction occurs primarily through the gluteus medius, gluteus minimus, and TFL. These three muscles are the primary frontal plane stabilizers during single leg stance and upright function. Hip adduction is performed by the adductor magnus, adductor longus, adductor